Well, thank you for continuing to watch the PolicyCast, and we are in the process of beginning to write legislation to report out of the two committees that are working on health care reform this year in the Senate. Well, I'm in an enviable position in that I'm on both of the committees that are trying to develop legislation in this area. And frankly, we're trying to do a variety of things. We're trying to reduce the cost of health care for Americans and for the country overall. At the same time, we're trying to expand coverage so that we don't have the circumstance that exists today where 45 million or so Americans have no coverage, and the cost of providing health care to them winds up being shouldered by those who do buy coverage. So we're trying to spread the cost, keep the cost down, and provide higher quality health care as well. This whole reform effort is designed to try to ensure that all Americans have access to affordable health insurance. It is not an easy thing to do. I think we want to have some responsibility on everyone. Every individual should have a responsibility to obtain coverage. Those who cannot afford to do so need to be helped through some type of assistance, subsidy or otherwise. Clearly, the employers who are able to provide coverage should be encouraged to do that, and we're trying to ensure that the coverage that exists today is able to continue so that nobody who's happy with their coverage has to change coverage. I think this circumstance we have now with a great many people not having health coverage winds up putting a heavier financial burden on those who do obtain coverage. The problem is you've got 45 million or so people who really only wind up getting health care after they're quite sick and sometimes through emergency rooms. We think that the cost of providing health care to them could be brought down and could be more equitably shared if everyone had some type of coverage. Well, we want to make insurance affordable to everyone by first of all ensuring that folks who are able to obtain coverage and pay for it have an incentive to do so, and that's part of the reform plan. We also want to be sure that those who would like to get coverage and can't are assisted in their efforts to do so. We're also trying to put in place some additional options so that people are not just locked into buying health care from those health insurance companies currently in the business. We're trying to say that there should be a public option that people could go to and buy basic health care at a reasonable price. Well, I think this is a major challenge to try to get agreement on all of the different aspects of healthcare reform and get bipartisan cooperation to enact something here, but we're working in good faith to do that on both of the committees that I serve on, and I'm hoping that before the end of this Congress, particularly if at all possible before the end of this year, we can enact comprehensive healthcare reform.